Modern body posture, which is very connected to sitting on chairs, often limits the amount of opening of the hip. By opening the hip, I'm talking particularly here about the lateral rotation of the hip joint. I've got some leg bones here. This is a left leg. This is the hip joint itself. This is the femur bone, the patella, and the lower leg, the tibia and the fibula, and the foot. So this is the left leg. That's my left leg there, sitting like that. All right. So in a body that is used to linear movement, i.e. running, walking in straight lines, and sitting up and down in chairs, sitting in cars, sitting in chairs, so it's just this kind of movement, oftentimes the outward movement of the hip can be quite limited. Now, one of the complications comes then when somebody does try and sit on the floor, if they're not used to doing that, is that when that hip opens outwards, what happens is impingement on the medial part of the knee joint here. This is the medial is the middle, lateral is the outside. So if somebody's trying to open their hips up, then very easily we can get that forced closure or impingement on the medial compartment of the knee joint. Hope you can see that clearly there. Really good, okay? So that can cause problems. What the problems it can cause is that what you don't see in here, is there are minuscule cartilages, moon-shaped cartilages, sitting inside here, which guide the joint in movement. There are also ligaments on the outside, and crossing ligaments, cruciate ligaments on the inside. However, the piece we want to pay attention to is the minuscule cartilage. Now, cartilages have no blood supply to them, virtually, and they're aneural. That means they have no nerve supply to them. So you don't know if you're injuring it until you've injured it. Now, minuscule knee problems are a big problem anyway. And for people who are doing yoga type practice, they are one of the most prominent injuries because people are impatient. So, and don't know how to do the work. So what we're doing here is finding a way to sit in a position like this, for example, yes, or for example this one here, yeah, with safety. Okay? Because if you try and get in this in the wrong way, which I'll show you in a second, you're just going to damage your knees. You're going to damage the medial compartment of the knee joint. Now, like I said with this position before, the ankles should be flat and open. The soles of the feet facing up, yeah, and the toes curling around the top of the thighs, and both knees on the ground. If that's not happening, if something else is happening, you're hurting yourself. So, for example, what we often see here is one knee lifted. And that means that one hip is still tight, yeah, and that medial compartment of the knee joint is being impinged. What we often see is people being impatient, and this ankle is forced up like that underneath, and the other ones come on top, so it's something like this with the ankles forced, and that is going to over-lengthen the ligaments on the outside of the ankle joint and destabilize the ankle joint. So to come into a position like Padmasana, the lotus, yeah, an amount of patience and systematic practice is needed. A really safe way of opening the hips, yeah, is to sit like this with the feet in front of you, a good hand span away from the pubic bone. Yeah. Now, if you sit like this, the most likely thing that's happened is your knees will be up here. So there's no point in having your hands forward. What we've got to do is take the hands a good 10 inches or more behind the back and lean back on the hands. And when you do that, your knees will start to drop. If you come forwards, it's likely that as you come forwards, your knees will lift. Because what you're using to lift yourself up with is the psoas muscle, psoas major mostly, which runs from the inner thigh, yeah, up along the inside of the spine. It is the big spinal stabilizer, along with piriformis. So it works at holding the spine forwards when you're walking, running, moving, yeah? And you use it to sit up here, and it pulls your knees up. So when you're pulling your knees up, it's also pulling them up in here, and you're going to slight internal rotation, and you're risking impinging the joints. Yeah? If I hold here and come forwards, I am actively rolling the femurs into the medial compartment of the knee joint. So as I come forward here, what I'm doing is actively doing that impingement. So that's really not sensible to do that. In a lot of yoga classes you go to, of course, people do that kind of thing. So they're coming forward here and then trying to get their head to the knees with the knees off the floor. And that's just squashing your knee joints on the inside. Not a clever thing to do. So if you can't get your thighs down to the ground fully here, yeah, then don't go forwards. It's real simple, just don't do it. And don't try and do positions where you're going into a half lotus or a lotus yet. Patience is needed. Systematics are really important. So the principle here is to lean back on the hands until your knees drop. And that's the psoas switched off. From there, you roll the shoulder blades down the spine. Squeeze the front and middle of the pelvic floor gently as you breathe in. A long, slow, steady in-breath. Remember that when you're breathing deeply, yeah, the nervous system is being relaxed. So any unnecessarily tight muscles can start to be processed from the inside into a place of relaxation and softness. Right. So you want to breathe in, lift the heart. That's upward energy there. And then out breath, squeeze the thighs down into the floor. Actively squeeze them down. And you'll feel the areas of tightness probably along the adductor line here. As you progress with this, it'll be more internally into the pectineus. But these adductor lines will start to feel a bit tight, and you can process that. It's highly likely that one of your knees is going to be higher than the other. Asymmetry is normal. In which case then you can process that side and work that one side down into the ground. If you practice this, you're going to be taking an in-breath, breathing in from the pelvic floor up through to the heart, through to the crown, in-breath, out-breath, squeeze the thighs into the floor. And at the end of that movement, gently release the thighs. Stay tall in the spine. In-breath, breathe in, lift a little bit more. Out-breath, squeeze the thighs down into the floor. Obviously my body's quite open, so if you're higher, then there's going to be work to do. Having said that, when I started doing this kind of practice, I was a runner. I ran a lot, miles. 12, 13 miles a day was my thing. Across mountaintops, a lot of my muscles were very tight. I was also a rugby player and into all sorts of other activities. So when I started doing this, my hips were like this, and I used to sit like this. I couldn't do anything else. My body was so tight. So I've had to do that processing work, and I've learned the hard way how to do it, because the people that originally taught me didn't teach me how to do it in an intelligent way, so I ended up damaging my knees. So that's why I'm teaching you this, so that you don't have to do that. So if you go to yoga classes and people try and get you into positions like this kind of thing, and your hips aren't on the floor, it's premature. Be patient. Do the preparation. Do the work. So again, in-breath, breathing in, full deep in-breath, full deep out-breath, squeeze down into the ground. Yeah? You'll feel your butt cheeks really switch on here. Get them down into the floor. Yeah? Then hold it there for a moment and then release. Again, in-breath, 12 breaths like this. Full deep breath, out-breath. Inhale. And exhale. Great. 12 breaths like that. And then you do 3 repetitions of that. And you do it every day for a while. Or 5, 6 days a week at least. And you build up and your hips will open. Unless you've got a hip condition like femoral anteversion, which may limit it, or hip dysplasia or something like that, where the hip structure is slightly different and your hips won't go down to the floor fully because of the structure, which is about 10% of the population. So listen, see, feel into the joints. And what you're looking for is a distinction between bony impingement and soft tissue tightness. So if your tightness is along the inside of the thighs here, fine, go into that in an intelligent way. Don't force it, don't go into pain. Yeah? Give it time. If you feel tightness in the back of the hip joint, around the joint here, yeah, then go gently, go easily. You're looking more at some kind of bony impingement there. Don't push it. Other positions are available. So that's a little bit unsafe hip opening. If you've got to the point where you get your thighs down, and some of you will be at that point already because of your natural body structure, yeah, what you're going to do then is work at coming up on the fingertips. Don't do this until you've got the thighs down to the floor. Make sure you're down, up onto the fingertips there. And that's the next phase of being able to do this, is sustain the descent, the downward energy, yeah, through the thighs, through the legs into the floor. as you build the upward energy up through the chest. The next step in this is to be able to come forward with one hand rested on the foot, just gently, without the opposite knee lifting. Yeah? So it's highly likely that you bring one hand forward, the other knee will lift to try and stabilize your spine. So if that happens, just wait. Just practice bringing one hand forward and back, keeping the thighs on the floor. All right? Maybe it'll take you a month to do that, or 2, or 3. It doesn't matter. Yeah? And the next thing to do is to be able to bring both hands forward like this, onto the feet, sustaining the lift through the spine, sustaining the descent through the thighs, so you can sit here in this position like that. That's the next phase. And there are other phases to come forward. And this is all necessary before you go into something like lotus, because this looks after your knees. So the next phase is to take the index finger around, hold onto the ball of the feet, yeah? Plant those thighs down to the floor, and start to come forward here over the hips, but there's no lift in the knee joint at all. Those femur bones are still rolling back. Okay, and slowly come forwards. Now I'll help with that on retreat when we meet. So I'll go again looking at the knee joint here. If this femur bone is rolling inwards as I come forward, and then I try and lift into a half lotus, what I'm doing here is simply grinding the knee joint away. Like that. Okay? So a lot of yoga classes, people are doing this day after day. They're going to yoga class and they're grinding away at their knee joint. Not clever. Yeah? So ideally we get enough openness, lateral rotation in the hip, so that when we lift the knee into place, that hip is moving. It's not a grinding of the knee joint, but an opening of the hip. So I'll show you that movement. All right? So with one leg in place, yeah? It's a lifting, it's an opening of the hip here. Yeah? It's an opening out of that hip joint, not a grinding of the knee. So that's a little bit about safe opening of the hips, and that gives you access to stable, strong sitting positions. Until such time as that's available, then it can be comfortable to sit in this position here, this base here. This is Sukhasana. This is fantastic. And the foot ankle dorsiflexes, so we're turning the toes in slightly, yeah, and resting the shins onto the medial arches of the foot here. And this automatically pulls you onto the front of the sit bones for deeper breathing. If you relax the feet like that, it tends to put you onto the back of the sit bones, flex the spine, and shut down the area around the diaphragm. So this dorsiflexion here into Sukhasana, and you can play with it with both feet, different directions, so you can have one foot forward and then the other foot forward. Yeah? That really helps with sitting and breathing. One proviso is that when you're in this position, if you put your hands on your iliac crest, which is these bony prominences at the top of the pelvis, the knees should be at least just below that line. So if the knees are higher than that, your psoas is going to be strongly on, it's going to pull you into flexion slightly or make breathing harder. So a useful thing to do then is get up on some yoga blocks. I have one to hand here. Something of that kind, 1 or 2 of those, and lift up so the knees go lower. Any kind of lifting, bolster or whatever, anything will do the job. Okay, so that's a little bit about safe opening of the hips for deeper breath work.